When we think of the medical profession, often the first people we think about are doctors and nurses, or maybe our pharmacist. But the medical profession is made up of lots more people and jobs who are all part of the vital team that work together to make us well again when we are ill or injured. All of these jobs are called the allied health professions. To understand this more, take Seb. He's happily riding to his friend's house on his moped. On his journey, Seb begins to feel unwell. This causes him to lose control of his moped into the path of an oncoming car. Because he is injured, St John Ambulance are called. The paramedics are on the scene fast and assess, stabilise and manage Seb's pain before taking him to the hospital. When he arrives, doctors and nurses assess him. However, before they can make any decisions about his treatment, they need to involve the wider team of healthcare professionals. A vital part of the assessment involves X-rays and other radiographic investigations performed by radiographers in the radiology department. Seb also needs to have a series of blood tests to investigate any underlying cause of his accident. As he is likely to need an operation, biomedical scientists from the pathology department analyse his blood samples and cross-match Seb's blood in case his condition deteriorates and he needs a blood transfusion. The results of his X-ray show he has broken his jaw, wrist and ankle in the accident. He also broke a tooth and has a lot of pain in his back. Back in the emergency department, doctors also think they have detected a problem with Seb's heart, which needs to be investigated in more detail by specialist clinical physiologists. So, Seb needs an operation and is met in the theatre reception by the operating department practitioner. They will stay with him, assisting doctors while his anaesthetic is administered throughout the operation and into recovery. The operation was a success, so he is now taken to the ward by a porter. He will stay on the ward until he is well enough to go home. Because he has a range of different injuries, quite a number of allied health professionals need to be involved in Seb's recovery. There's the orthoptists, who need to assess if there has been any visual impairment as a result of the head and face injury. A dentist from the Children's Dental Service needs to see him because he broke a tooth. A specialist dental nurse gives Seb advice on how he should keep his teeth clean with his broken jaw. Pharmacists visit the patient on the ward to ensure that he is getting the right doses of medication and advise on forms that he can take his medication in if he is unable to swallow easily due to the broken jaw. A dietitian also has to check he is getting the right nutrition and will recommend the right foods or suggest liquid feeding or through a tube depending on how bad his injury is to his jaw. Due to the head injury, he required assessment and advice regarding swallowing and communication difficulties from the speech and language therapy team. Before he can go home, the occupational therapists become involved to assess him and start rehabilitation. They will assess how his injuries impact on his functional ability to living at home and back to school. They will agree a treatment plan with Seb that will ensure he regains his independence in all the daily activities that matter to him. The physiotherapists work as part of the team to help improve Seb's physical functions and mobility. As he is still young, the Children's Social Services need to work with the family to make sure there is enough support in place for him and the family when he returns home. But it doesn't end there. With Seb back at home, the effect of the accident continues. He suffers nightmares and flashbacks and shows the signs of PTSD. This requires the support from the psychologist and child and adolescent team. It's easy to see in this example that to provide the best service to a patient, everyone needs to work together as a team. The healthcare profession is made up of so many people in a number of different roles, and each one is equally important on the journey a patient takes to recovery.